He identified one other social and household primary close contact, but of course this number may change when the interview is completed. Primary close contacts, however, will include past residents of the Holiday Inn who have completed their quarantine period as of the 7th of February, at least in regards to people on that particular floor. These return travellers will be also required to isolate for a further 14 days. The department are currently in contact with that group and we'll have more to say in terms of specific numbers as soon as those are landed. We know that this will come as difficult news to those people who have just completed their 14 days mandatory hotel quarantine isolation, but it is a necessary public health move. I can also inform Victorians that literally in the last 10 minutes we've been advised of another positive case related to the Holiday Inn. This is a worker at the location who has just tested positive in the last few hours, and in terms of the information that has just come to hand, it would appear that the person as a worker at the hotel has been in the exact same exposure period as this most recent case of people in and around that particular facility. This information has just come to hand literally on the way here. We will identify further information in regards to that and release that as soon as we possibly can. Outbreak management responses have been established and Professor Sutton has joined us and has been involved in all of those detailed discussions, and I might get him to add further to my comments. Thank you.
Thanks, Minister. So it does relate to likely transmission within the hotel quarantine system. Obviously, people go to the potential that this is a longer incubation period for this virus or a virus of a variant of concern. We don't think that's playing out here. We think that it does relate to transmission within the hotel quarantine system, and therefore someone who has already done their 14 days and has left quarantine but been exposed maybe just before leaving quarantine then develops illness. We think that's what's happened in this case. Therefore, the focus of our attention is on the transmission that might have occurred on the relevant floor where positive cases were known to be. So that's the focus of quarantine for everyone who was on that floor. It also relates to all of the staff who are on the floor during a relevant period of time as well. So they're being quarantined. The residents on that same floor are also being quarantined. You would imagine that residents are low risk because they are also in their individual rooms, but obviously there's been a positive case who's emerged already, and so we really need to consider everyone who's on that floor at greater risk. This is an issue for quarantine across the board in Victoria, across Australia, and really in any country that's got a formal hotel quarantine system. It's probably always been a risk, but with these variants of concern with greater transmissibility, it really does require that end-to-end review process. My understanding is that it's front and centre for discussions amongst Chief Health Officers in coming days, beginning tomorrow, and that it'll be an end-to-end review of all of the mitigations that can be put into place, including the testing before someone leaves their country of origin to come to Australia, but also that Swiss cheese model, all of the systems elements that you can put in place that reduce the risk of transmission. So that's the distancing, the cleaning, the testing, and the personal protective equipment and everything in between. So that's going to be a focus for my colleagues and I this coming week. But already, obviously, we've got a program in place to review how transmission might have occurred and to quarantine all of those who might be potentially at risk.
So, any questions.
I realise it's early days in terms of contact tracing, but are you aware of any links between, you've now got 2 workers and 1 former resident of hotel quarantine, are you aware of any contact between those 3 people? And were those 2 workers both working on the same floor where the person who's tested positive was residing?
It is early days. The initial indications is that's one of the areas that's been explored, and as soon as we've resolved those issues, we'll of course share those with you.
Have you done any testing of the residents in the Holiday Inn in addition to, at the moment, people who are in hotel quarantine get tested on day 3 and day 11. Have you done testing in addition to that to ensure that you haven't got residents who you don't know about who've tested positive?
So we're certainly testing all of those people who were at the facility at that time and have subsequently moved away, have been released in the normal processes, and there's processes going on at the moment with them. In terms of what CQV's arrangements are for the remaining residents of that facility, my understanding is that they're looking at all possibilities, but I'm sure we'll have more to update you with that as that comes to hand.
Do you need to shut down the Holiday Inn until there's a specific hole in there?
Not at the moment, we don't think so. The numbers are right down anyway, for a variety of reasons, with the number of staff from the authorised officer who were close contacts. The capacity of that facility has been reduced, so it's really come down in terms of numbers there. It's early days, but it would appear that it was one particular floor, and that floor has certainly not taken any further residents, but CQV are going through a process, and if there's the need for any further measures, then they'll certainly be taking them.
You're set to put in a very slight increase to our cap on Monday in terms of incoming overseas travellers. Is that still going ahead despite us having 5 restrictions in hotel quarantine in the past week?
Well, as the Premier indicated this morning, everything is always under review. The Victorian Government is deliberately taking a cautious approach to these issues. Our National Cabinet has set in place a process for the gradual increase in numbers, but the Victorian Government's position is that everything is always under review, and the public health advice will determine our response.
What role was the most recent hotel quarantine?
I beg your pardon?
What role was the hotel quarantine worker performing?
The most recent one, as I understand, it's a food and beverage worker.
How many people on the floor who since left are now considered close contacts?
I don't have that figure, but our friends at CQV will, I'm sure, be able to provide that as soon as we can.
I've got a question for Greg, if that's
Yep.
okay. Does this worry you? Are you nervous? Do you want to recommend changes to what we're doing in quarantine?
I want a root and branch review, just like everyone else. I think the issues across Australia are really reflective of an increased risk with the new variants of concern. But it's always appropriate to do a critical incident review with each and every case of transmission that you get, and as we've always done, take the lessons that we learn here in Victoria for national consideration, but also here out of the Queensland review, out of review that will be undertaken in WA, to also take anything that they are finding out through their critical incident reviews.
Something has obviously gone wrong there, or it is very much airborne aerosol within that facility. So, are you comfortable with that facility remaining open?
Well, we'll as the Minister said, we'll go through a process of review and discussing it in terms of the operational needs, how much it's been pared back already, and advise if that's required. I've got a further meeting tonight. It'll be a topic for discussion, no doubt, but at the moment it is absolutely focused on that floor, and all of the individuals who've been on that floor, staff or residents, are going to be in quarantine and will go through the testing process. If there's any indication that the risk extends beyond that floor, then it's an option for us to close the hotel if need be.
The Premier today said that Victoria has the highest standard really in the country when it comes to hotel
understand that some people might not view it that way now. There has been 5 cases in the last week of transmission.
Yeah, look, cases can happen anywhere at any time, and they can happen without a breach of protocol or without any particular errors being made. We are talking about an incredibly infectious virus, and we are learning new things about the potential modes of transmission and how significant that risk is. We have known that airborne transmission is possible. The extent to which it occurs and how well you can reduce that risk through all of the measures that we've got in place is a matter for ongoing review. And Victoria's been hit pretty hard this week, and some of this relates to a single incident. But we will continue to maintain our focus on understanding what's gone on and doing everything necessary to make it right. But my reflection would be that this is a risk across Australia. Just because it's happened in Victoria at this point in time doesn't mean that the risk is not an issue in any formal quarantine system really across the world.
So why do you think this has happened in Victoria? Have we just gotten unlucky again?
Well, we don't know. We don't know exactly what's happened yet, so I wouldn't like to speculate. But there is an element of randomness here in terms of when cases occur. But it's also how hard you're looking. We've discovered transmission within the quarantine system that before genomic testing and before the kind of intensive investigation that we've now got as a routine, that wouldn't have even been noted. That would have been missed, and we would have thought there was no problem at all. We're identifying issues now by virtue of how intensive the investigation and the testing is.
You mentioned a single incident. Are you working out of the assumption that these 3 Holiday Inn cases are all linked, or they're all infected at the same time? On the same...
Yeah, obviously the most recent case just announced will be investigated over the course of tonight and tomorrow. So it's really hard to say. I would imagine that it relates to the known positive cases on that floor and transmission on that floor, but we need to go through a process of interviewing to understand exactly if that's the case.
Was that person on the same shift as the other worker?
So all of that needs to be investigated. We don't know that being interviewed as we speak.
So you're working on the assumption that woman who tested positive after she left hotel quarantine picked it up in the hotel and not overseas?
That's right. That's right. Because had finished the full 14-day quarantine period, became unwell after discharge.
So there's no reason to extend mandatory quarantine more than 14 days?
No, look, again, we'll be open to whatever the evidence points us towards, but it seems to be an issue of picking up the virus during the quarantine period rather than the virus having a longer incubation period and people developing illness after the 14 days. That hasn't been evidence internationally that's been shared that it's got a longer incubation period. It does seem to be the issue of infectiousness and the risk of transmission within quarantine.
Do you want day 16 testing? Is that something that you're...
I think we need to talk it through. So HPPC will discuss that amongst a number of other issues tomorrow and in coming days. It may be day 16, it might be day 17 or 18. You want to make sure that you're maximising the likelihood of picking up transmission within quarantine for people who go on to develop illness after they've been discharged. But you don't want to have them in the community going to a number of exposure sites for days. So it'll be a balancing act, and it might be multiple days of testing, or it might be a check-in for symptoms on particular days and testing at a later time. So that requires modelling. It requires us to reflect on everything that's happened in these circumstances. But I think we need to look at it all, and we need to do something more. No question.
Oh, sorry. Given this push for day 16 testing and what we know about the woman in New Zealand and also the woman in Wollongong, is there any reason why you're working on the assumption that this return traveller picked it up in a hotel and that it isn't necessarily a longer incubation period of the virus?
So we are looking at the genomic links. If you see that it's related to cases who were already in the quarantine system at the time, then transmission within the hotel quarantine system becomes understandable and the explanation. If it's the virus from their country of origin or if it's genetically different, then that would indicate something else going on, and maybe a longer incubation period, but we haven't seen that. We're looking at cases that appear to be genetically linked.
And which country is this return traveller from?
I'm not sure in this latest case.
Do we know about her age? And can I also ask, did she have symptoms, or did she just volunteer to go get tested because she was at that?
No, we've literally heard about it in the last 15 minutes, so we don't have details at the moment.
The return traveller.
Sorry, for the
Return traveller.
for the return traveller who's tested positive,
Yeah.
I don't have further details.
I'm just wondering, what other states are copying Victoria's hotel quarantine model?
There's an element in which all other jurisdictions, I understand, are taking on some of the best practices, if you like, in the Victorian quarantine system, including the daily testing of hotel quarantine workers. But you know, every jurisdiction has a number of interventions, a number of practices, and we're all reflecting on each and every one of those elements across the country.
That floor that seems to be the problem, that's now being cleared. There's no one on that floor at the moment.
I don't know that it's been cleared entirely. If there are people who are completing their incubation period of quarantine on that floor, that's not inappropriate. But we'll look at what the operational needs are and whether there needs to be a further paring back of anyone on that floor.
And food and beverage delivery workers at hotel quarantine, do they have face-to-face contact with the residents? How does that process work, and what's their role?
I'm not sure in this instance. We'll come back to you with that. But obviously, food is delivered to the door. The door is knocked on. There's no close contact for delivery of food, but we need to go through the interview process again to know exactly what's happened.
As in they wear surgical masks and a face shield and full PPE?
Again, we'll need to come back to you for that specific worker.
And do you know if there's CCTV on that floor?
I don't know.
The case mentioned this morning who's in hospital after, in ICU after being in hotel quarantine. Do you have any further details on them, what hotel they came from, age, gender?
So that was a Holiday Inn quarantine case, as I understand it, but I don't have any further details on their clinical status.
Wasn't a hot hotel.
So that was an individual who was there, tested positive, moved to a Medi hotel.
A couple of days ago, the Premier, or at least Neville, I think, she might have mentioned that there was a family of 3 at the Holiday Inn Hotel, the UK strain virus, who had been moved to a health hotel. Do you know if either this return traveller or the food and delivery worker had any contact with that family?
So we've got no direct evidence of that close contact, but we are again still working on the likely transmission from that floor, despite there not being close face-to-face contact.
And the person who's in ICU, are they a member of that family of 3?
My understanding is that they are, yes.
Do you think we'll see more cases linked to the Holiday Inn?
I think we have to be ready for them. Obviously, going very broadly with quarantining all of the staff of relevance on that floor over the relevant period of time, and those other residents, means that we need to take that precautionary approach, make sure everyone's in quarantine and test right through that quarantine period.
And are you working on the assumption that this return traveller and also the hotel quarantine worker has like either the UK or the South African variant of the virus?
Look, it wouldn't surprise me. The majority of cases that are now being detected in hotel quarantine are variants of concern. They are becoming the predominant strain, and we really work on the basis that we should expect each and every case that we identify in quarantine to be variants of concern.
Just a quick question for Ms. Foley. In New South Wales, it's found that Crown Air is not suitable to hold a licence. How would that affect the Crown here?
Well, my focus, unsurprisingly, is to respond to the coronavirus pandemic. I'm sure I can get the relevant minister and the relevant independent agency to respond to you shortly.
I suspect your answer to my next question might be similar, but Eddie Maguire's just stepped down as Collingwood president. The Premier made it very clear that Eddie had his support this morning. Was the Premier right to do that? And has Eddie Maguire done the right thing by stepping down?
You're right, Rachel. My response is very much focused each and every day on getting on top of this pandemic and keeping Victorians safe. What happens at the Collingwood Football Club is beyond that remit, so I might pass on that one.
And just on this hotel quarantine worker who tested positive, any indication when you might be able to release the exposure sites?
literally, as soon as all of that, on the way here, I was advised of that, and I decided to take the opportunity to share that information with you all. Those processes of interviewing the person are underway, and as soon as all of those details are available, we'll release them in the most timely way to make sure that Victorians are safe. But the good news is that from the case from the first person is that there would appear to be, at this stage, no exposure sites and only one direct close contact. That person has done precisely the right thing and in fact shows the value of the rigorous testing and moving quickly on this information, but it also shows the wildly infectious nature of these variant strains of COVID-19, that this person with no direct exposure to the family but on the same floor has seemingly picked up the virus, and it would appear from initial very early indications that the same thing has happened to the most recent worker as well.
There are about 600 hotel quarantine workers who are stood down because of the Grand Hyatt case and a further 80 because of the initial Holiday Inn. I suspect there'll be even more
Yes, I would expect so.
quarantine workers identified as close contacts. Are there enough staff to be able to maintain a hotel quarantine
Well, this
program?
goes to part of the issue that I think you raised earlier as to foreshadowed increases in returned figures for travellers. We will do what is safe and what the ability of the workforce, a dedicated, discrete, solely working on COVID workforce, will be able to handle. And we'll take the public health and the CQV advice as to what that number is.
The most recent case you just found out about, that was a woman, was it?
I literally do not know. All I know is it was a food and beverage worker.
And was that person getting tested in the first Holiday Inn?
No, that person was tested because they were nominated yesterday as a close contact through that wider pool of everyone in that facility coming under that definition. So again, the processes that we've had in place draw a direct link to the wider set of circumstances at the hotel, the Holiday Inn, and that person was picked up through that close contact process.
Can I just ask for another question on quarantine? Given what we're seeing with, the new variants, and as you said, majority of the COVID cases are with the mutant viruses, do you think it's time to maybe put a bit of a pause on, accepting return travellers and for National Cabinet AHPPC to really work through all of those details?
Look, that's really not for me. I can speak to the risk and the mitigations that we have in place, the possible effect of vaccinating hotel quarantine workers, but it's really a matter for Cabinet and for First Ministers and National Cabinet around CAPS and the entire quarantine process in Australia.
As a public health expert and the Chief Health Officer of Victoria, though, what would your recommendation be?
No, I really can't make a recommendation because I can speak to the risk, but these are matters where you're balancing, the welfare concerns of Australians, permanent residents and citizens who are trying to come home and are sometimes in really difficult circumstances. That's not for me to balance. Those are tricky priorities for all of those in other positions in the country to consider.
Do you think we're balancing it well?
I think it's an ongoing challenge. There's no question that we need to continue to put our minds to every single intervention, and all I can say is bring on the vaccine. Hopefully that's a protection for hotel quarantine workers. It should be a consideration for the broader community of especially vulnerable individuals and those at greatest risk of exposure, which includes those in the health system who need to look after people who require medical care. And indeed, potentially hoping that some of those travellers who are coming back to Australia also have an opportunity to access the vaccine before they come to Australia. You'd hope that that's another mitigation that can be brought on as soon as possible.
Would you support vaccinating those travellers once they're in hotel quarantine?
If that's an option, if that's decided as a national priority, and again they take advice from the Australian Technical Advisory Group on vaccines. But if that's an option, we'd operationalise it. But it is a national conversation and needs to be decided for all jurisdictions.
And early research suggests that the AstraZeneca virus only has 10% of efficacy against the South African variant. Does that concern you?
Yeah, look, variants of concern can be concerning for different reasons. One, they can be more infectious and transmissible. That's the case for all of the variants of concern that we're now too familiar with. They can potentially cause more severe disease. That's an early indication for the B117 strain that was first identified in the UK. And then with the South African variant of concern, there is the worry about immune escape. So the AstraZeneca vaccine not having as much protective efficacy against it. That is a worry. Nonetheless, it appears to still protect from dying and from severe disease. And so there is the direct protection of vaccines against those severe consequences. But of course, we want vaccines to be really useful in terms of you're not getting infected at all in the first place and really stopping transmission from occurring. And so we need to keep watching what's happening with the AstraZeneca vaccine against that particular variant of concern. But there are other vaccines that will have different efficacy and other variants that emerge. We just need to keep an eye on it. But I think the reassuring bit across all of the vaccines that are in use is that they do protect against dying, they do protect against hospitalisation, severe illness, and that's a useful thing regardless of what it might do in terms of risk of infection.
All good?
Thank you.
Thanks, everyone.
Thank you.
I'll see you tomorrow.
Oh my God, yeah.
Oh my God, God,
Thank you for talking as well.
Like just every
Yeah, go.
Oh my God.